women shouldn't follow the advice of someone who isn't going to be there to pick up the pieces afterwards. They should listen to their medical clinicians who are actually going to handle some of the complications of their pregnancy.
Health officials in the UK have rushed to reassure women that paracetamol is safe to take in pregnancy. They've been forced to react after President Trump said there was a link between the use of the drug and children getting autism. The UK's medicines watchdog, the MHRA, responded by saying,
"There is no evidence that taking paracetamol during pregnancy causes autism in children."
And they urged women to follow NHS guidelines, which state,
"Paracetamol is the first choice of painkiller if you're pregnant. It is commonly taken during pregnancy and does not harm your baby."
During a meandering news conference that lasted for almost an hour, President Trump said he was ordering doctors to stop prescribing the drug known in America as acetaminophen to pregnant women.
First, effective immediately, the FDA will be notifying physicians that the use of acetaminophen, is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good.
Well, the Times science writer Tom Whipple told us there had been one small study which suggested a possible link between paracetamol and autism, but a much bigger one with better controls showed no link at all.
And what this did was it compared siblings, and it found that among siblings who grew up in the same environment, had the same parents, you found no link between paracetamol and autism. But, there are 2 million research papers put out every year, and you can often pick the ones you choose to give the answer you want, which is why organizations like the medical regulators exist to try to assess the evidence. And, it's very, very hard to prove a negative.
Yeah.
But as best anyone can tell, there is no link.
Well, President Trump also reheated several well-known conspiracy theories about vaccines, including about the MMR vaccine, the measles, mumps and rubella.
The MMR, I think, should be taken separately. This is based on what I feel, the mumps, measles, and all the three should be taken separately. And it seems to be that when you mix them, there could be a problem. So there's no downside in taking them separately. In fact, they think it's better, so let it be separate.
Well, let's find out the implications of Donald Trump's claims and try and debunk some of the things that he's raised there in that speech with Dr. Monique Botha, who's an associate professor in psychology at Durham University. Welcome to the programme.
Hi there.
Shall we start? We spoke a little bit earlier to Tom Whipple, our science writer, about this, but for clarity, is there any evidence at all for what Donald Trump is saying about paracetamol? Is it a drug that pregnant women who are listening to this programme should avoid taking in pregnancy?
Absolutely not. So the most robust evidence that we have to date is of more than 2.4 million people, and it's sibling control. And that showed no relationship between taking paracetamol while pregnant and autism, ADHD, or learning disabilities. That is the highest quality standard data that we have on this topic. And there are earlier studies that were correlational that didn't control for confounding variables, including just genetics, family history. And we know that it is something that is predominantly genetic and heritable, which is obviously a big problem with those early studies. But you can find something that supports almost anything, and it will probably be a little bit of a bad correlational study. But the actual studies that measure causation, it shows no relationship.
How concerned are you about hearing remarks like that from Donald Trump? I suppose on behalf of people who are currently pregnant, women who are currently pregnant, but also on behalf of people who have autism.
There's a couple of things. One, I'm worried that people are going to buy into some of that fear mongering, and at the end of the day, you don't expect such genuinely terrible health information coming out of a government's office, especially not one that holds so much power globally. Women shouldn't follow the advice of someone who isn't going to be there to pick up the pieces afterwards. They should listen to their medical clinicians who are actually going to handle some of the complications of their pregnancy. But we know that fever and pain during gestation are actually things that have adverse consequences for fetal development, which means that when you are prescribed paracetamol, it's really important that you take it for a whole host of reasons.
And what do we actually know scientifically about the causes of autism, about why some people have autism and why some people don't?
It's genetic, it's heritable. There are so many different genes that are implicated. And also, we have this idea that it's something to be feared, and it's not. I know that parents of autistic children and autistic people themselves have been holding their breath over the last 24 hours for whatever offensive thing would come out of this. And the problem is it is also deeply offensive. And the reason is that autism isn't something to be feared. It's genetic, it's heritable, and we should be talking about how autistic people and their families can have good lives. This isn't going to help anyone. This isn't going to improve quality of life or outcomes. So I think a lot of what people are feeling is just anger and disappointment.
In your view, because there is research which suggests that more people are being diagnosed or presenting with autism, is that because we are now better at understanding it and picking it up and diagnosing it? Is that what lies behind those so-called increase in numbers?
Absolutely. And it's because we rewrote what it means to be autistic, and it's important that we did. The idea that we had of autism in the 1980s was really different to the idea of autism that we have nowadays. And it was that stereotypical image of a boy sitting in a corner rocking backwards and forwards who was perhaps non-speaking and had an intellectual disability. For the DSM-4 and DSM-5, we rewrote it because we had learned so much and realized that the spectrum was a lot broader, that there were a lot of people who weren't being picked up by that definition, who also had really astoundingly poor outcomes over their life, which means it's really important that we have picked these people up. But that gives people a sense that autism has dramatically increased, when in actuality we've just gotten better at figuring out who is included under that umbrella and picking it up.
And finally, Dr. Botha, Donald Trump also made some remarks about vaccination. He suggested it would be beneficial. There is a health benefit to splitting the MMR vaccine, and he also questioned the Hep B vaccine for babies. There is some concern in this country about vaccination rates, about some parents choosing not to vaccinate their children. Is there any evidence for what Donald Trump said about vaccination, and are you concerned about what this might do to vaccination rates in the UK?
No, there is no evidence for splitting it out. It doesn't increase the safety. At this point, we have so many studies on vaccine safety and developmental disabilities like autism that you can run meta-analyses, which is where you pool all of the participants, and you have more than, I'm talking 10, 11, 12 million participants, and it does not bear any relationship to getting diagnosed with autism or ADHD, right? So there is no relationship between vaccines and autism. I cannot stress that enough. And it's really important that we don't destroy herd immunity across the UK because someone is misrepresenting the science.
Yeah. Dr. Monique Botha, really great to have you on the programme. I appreciate your time. Thank you very much.
Thank you.
Dr. Monique Botha there, the Associate Professor of Psychology at Durham University.
Lots of people are very angry. Rachel says, I'm pregnant. It makes me so angry hearing Trump. It leaves pregnant women with nothing they can take if they're in pain, and pregnancy is already a stressful time with conflicting advice, and he's compounding that. I will just want to say, I think she's quite right, Dr. Botha, there to talk about autism is not to be feared. But as I've had 3 children, and I would never want to denigrate anyone who has autism, but you do worry about it. You do worry. Like, you want your kids to be healthy, and if they're any condition, or however you want to describe this, you worry about it.
People worry about the unknown, don't they? And pregnancy is a huge leap into the unknown for lots of people.
And I don't want people to think this autism not to be feared, because I've interviewed lots of autistic people, and some say it's a superpower, some say that's a very patronising way of thinking about itself. I think if you're a parent and someone tells you that could cause autism, you will be frightened of it. You don't want it to happen. You are worried about it, and that's what I think makes this so pernicious.